deficiency anemia. We already discussed iron deficiency anemia. So, as I said, when we have a confirmed case of iron deficiency anemia, we need to start iron treatment. This is different from iron supplement, okay, dietary supplement. Here we are treating the condition. Hala, we always, if there is no issues with oral iron, we have to start oral iron, preferred over parenteral iron. We have many salts of oral iron. Hala, the salts are available commercially. They are basically different in the amount of elemental iron they contain. Okay, يعني for example, one of the very popular salts هي الsulfate salt أو الferrous sulfate. Okay, هلا in the ferrous sulfate, regardless of the formulation, يعني ferrous sulfate is of syrup, tablet, and so on. هلا regardless of the 20% of the dose is provided as an iron. فبالتالي, if I decided to give the patient one tablet containing 325 milligram of ferrous sulfate, how much iron, elemental actual iron, that tablet will provide? راح تعطيني 20% of the 325 milligrams. Okay? Same thing. إذا أنا بدي أعطي سيرب اللي فيه 60 ملغ per 5 ml, 20% of that 60 mg هي عبارة عن elemental iron. How much actual iron the formulation or the salt will provide. هلا, we have different salts. We have the fumarate, the gluconate, the different formulations of sulfate. They are different in the amount of elemental iron they provide. Okay? For example, the ferrous gluconate, it provides the least amount of ferrous iron or elemental iron. إذا بقارن أنا 325 ملغ tablet of ferrous gluconate تعطيني 38 ملغ iron. بينما 20% of that tablet, okay, if it is ferrous sulfate, تعطيني 60 ل 65 ملغ elemental iron. Okay? هلا, how the oral iron salts are different. As you can see, they are all ferrous. لأنه إحنا حكينا إنه the iron form absorbed from the GI is the ferrous form. Okay, so they are ferrous salts. We assume they are comparable in terms of efficacy when given at equivalent doses. Okay, يعني ما بقدر أقول إنه السلفيت salt هو أفضل من الجلوكونات أو السكسينات أو. Okay, when you give them in the right doses and the equivalent doses, they are equally effective. They do share similarities in their kinetics, absorption, side effect profile, and so on. Right. How elemental iron? Routinely, okay, a range of elemental iron is somewhere between 150 to 200 milligrams on daily basis, and this should be divided in 2 or 3 doses. يعني, let's suppose I have a patient إجا iron deficiency anemia عنده low hemoglobin والiron stores consumed, ferritin is low. I want to start oral therapy. خليني أفترض إنه هو adult 35-40 years of age. How much iron I should start elemental treatment? We have to start somewhere between 150 to 200 milligrams on the total daily dose. وهدول we have to divide. بمعنى أنا ممكن أعطي الفرس سلفيت in 2 doses مثلا. إذا أنا قررت أعطي let's assume 150 ملغ مثلا، ممكن أضطر أنا أعطي من الفرس سلفيت الإكسيكيتد مثلا وبيعطيني 65 ملغ per 200 ملغ تابلت. أوكي، فمثلا إذا أعطيت أنا 3 tablets of ferrous sulfate، كل تابلت رح تعطيني 65 ملغ. إذا التوتال elemental iron قد إيه رح يكون؟ رح يكون 65 multiplied by 3. أوكي، طيب إذا أنا بدي أعطي الفيرس سلفيت 160 ملغ excicated tablet, each tablet gives me 50 mg. So if I want to give the treatment بدي أعطي 3 months. Okay. هلا إحنا بنحسب Yes.
دكتورة عفوا على المقاطعة بس الصوت كثير بيقطع.
تفضل. بيقطع؟
وأحيانا بيكون
صوتك بيقطع وفي إزعاج كمان، في إزعاج، في
آه.
ناس فاتحين المايك كأنه وصوتك شوي بيقطع.
طيب I will mute all of you. Okay. هلا الصوت أحسن؟ أحسن؟
لا دكتورة بعد بقطع.
No.
لا كان بعده بقطع.
أحسن هلا؟
لا دكتورة نفس الشيء.
Okay, let me now.
Yes, دكتورة.
Can you hear me?
Yes, yes.
Oh, طيب. Okay. يعني كنت عم بحكي عن how much elemental iron we have to start to treat iron deficiency anemia. The range is somehow between 150, the total daily dose, to 200 milligrams of elemental iron. Okay? هلا for elderly patients above 60 with iron deficiency anemia, we usually give a little bit less than 150 milligram. We can start with 120 milligrams on daily basis. Okay? Adult, young adolescents, we can start 150 to 200 milligrams, and we titrate gradually. هلا, if you start 150, that's okay. If you start 200 milligrams, that's okay. لكن أقل من هيك بالadults and young adolescents أو أعلى من 200 ملغرام يعني نعتبره إنه not appropriate. So you have to stay somewhere in the range. Okay. هلا حكينا هذا التيبل you have to recall it يعني بدكم تحفظوه لأنه الحسابات how many tablets I should give, for example, this depends on the amount of elemental iron that is variable from one salt to the other. هلا total dose of elemental iron should be divided into 2 or 3 doses. It has يعني the minimum percentage of elemental iron. طيب, if I decided to treat my patient with ferrous sulfate, okay, I want to use the, let me say the 240 milligram tablets. Okay, and I have a dosage form with 240 milligram tablets ferrous gluconate, and I decided to start my treatment. How many tablets of ferrous gluconate I need to use or give the patient in order to reach the target therapeutic goal? How many tablets I will need? If each tablet here gives me يعني somewhere between 28 to 29 milligrams of elemental iron. مين بيقول؟ مين بيحسبها؟ We need a minimum of 150 milligram. خليني أفترض إنه عم تعطيني هاي التابلت 30 milligram to ease the calculations. How many tablets I will need?
دكتور احنا رافعين ايدينا مبين.
I can't see. Yes, Rania. Yes, Rania. How many tablets to hit the minimum 150 milligram of elemental iron?
5 tablets.
تقريبا 5 tablets, right? تقريبا 5 tablets. طيب, is it يعني convenient to give 5 daily doses of oral iron for adherence compliance purposes? بتوقع إنه مريض ياخد 5 doses or unlikely, right? وإحنا حكينا إنه بالoral iron because the treatment term is prolonged. So we want to make it more convenient, okay? Reduce the number of doses to enhance compliance. فبالتالي ممكن أنا يعني أعطي elemental iron the same amount using the different salts, but you have to keep in mind which formulation makes it more convenient. فيفضل إنه the total daily dose of elemental iron is administered in 2 or 3 daily doses to enhance the compliance of the patient. Okay? هلا ال administration technique itself, how should we use oral iron? The recommendation is to use the treatment on empty stomach, no food. Why? Because food can actually decrease absorption. Sometimes food might contain items that can chelate with iron, impair its oral bioavailability or absorption. So the routine, the advice to the patient is take your iron on empty stomach at least 1 hour before the meal, at least, to enhance the absorption. Now, in many cases, taking iron salt on empty stomach will cause GI upset, okay? And this could be sometimes a reason that patients leave or quit treatment. طيب, what should we do? يعني إذا إجا المريض وقال إنه لما باخد أنا الأيرون on empty stomach, I have GI upset, okay? What should we do in this case? بنقول له, okay, take it after the meal. Okay, now taking it after the meal might impair absorption a little bit or its availability, but we want to assure that the patient takes the medication, otherwise patients will be non-adherent and there will be no benefit of oral iron. هلا, if we give oral iron, as I said before, we want to treat anemia, we want to normalize CBC, hemoglobin, but we also, the ultimate goal is to restore iron stores in the body. So the minimum duration is not less than 3 months, and sometimes we can go up to 6 months of oral iron supplement. For that reason, adherence is very important, okay? طيب, الأورال iron therapy can cause adverse effects. معظمها related to GI. Darkening in waste أو الفيسز material بصير يعني لون dark. This is expected. Why? Because as you know, iron absorption is under control by GI. Not all the iron will be absorbed. So some of the iron will not be absorbed. هذا راح يروح على الwaste material. It will cause dark. كتير مهم لما نعمل counseling للمريض نفهمه إنه ممكن لون الستول يتغير, becomes dark. أحيانا المرضى they think or they are scared that this could be a bleeding disorder أو إنه blood. فبالتالي they can just quit therapy. We have to explain to them, this is expected, this is benign, this is because some of the iron in the salt was not absorbed. It can cause change in the bowel habits. يعني مرضى ممكن يصير معهم constipation, diarrhea. Nausea and vomiting can happen, especially if the patient takes it on empty stomach. These adverse effects are usually dose related. For example, if I started 200 milligrams elemental iron a day, these side effects start to happen. You can go down a little bit to maybe 180 milligrams, 150 milligrams, while staying in the therapeutic range, because these adverse effects are associated with dose. Alternatively, what you can do, start a lower therapeutic dose, start 150 milligrams, and titrate gradually up if the patient can tolerate treatment. Okay? يعني هاي الادverse effects مرتبطة أكتر شيء بالدوز. هلا iron له potential drug interactions. Just let me finish oral iron. I'll take your question. Okay, خليني أخلص oral iron. هلا drug interactions variable. في أدوية they can impact the absorption of iron directly because they do chelate, okay, with iron, like many antimicrobials, fluoroquinolones, tetracyclines. Some drugs, and this is really important because these drugs are usually consumed on large scale over the counter. Okay, عنا هون معظمهم over the counter. اللي هم anti-secretory drugs, okay, like H2 antagonists, proton pump inhibitors, حتى الانtacids, يعني regular antacids like Malox, for example, or Gaviscon. All these, okay, can actually decrease gastric pH. وبالتالي, decrease gastric acidity. With less acidity, the absorption of iron is impaired. We have to educate the patient while they are taking the iron therapy, what drugs to avoid, or the need that they have a gap or time between taking their iron therapy and taking the other drug. Okay, ففي عنا drug interactions. Now, if we start our treatment with oral iron, we expect hemoglobin to start to normalize in few weeks. Okay. After hemoglobin normalizes, we expect that with treatment, the iron stores, ferritin levels will start to go up. Okay. What if we could not meet the endpoints of therapy? يعني we are not reaching to the goal. What should we do? يعني في عنا no response أو inadequate response أو failure of treatment. What should we do? We can do many things. First of all, we have to reassess that the patient is actually adherent. وهذا بالiron treatment كتير is a very common factor why patients يعني do not respond adequately لأنه المريض يعني ما بيكون adherent. Let's assume إنه بده ياخذ 3 tablets daily basis Q8 hours. ممكن ياخذ التابلت at morning وينسى الميد وتاني يوم يعني she skips a couple of tablets واليوم اللي وراه ممكن ما ياخذ iron نهائيا أو صار معه GI abscess so he is skipping a dose or two on daily basis. أحيانا after normalizing CBC patients feel better. They just skip the iron, they don't complete their course of therapy and so on.
دكتورة صوتك راح.
Adherence is one factor. Yes. Okay, we don't have interactions. يعني ما عم ياخذ over the counter drugs مثلا يعني action بتقلل absorption iron مثلا أو يعني بتقلل gastric acidity and so on. We have to investigate other underlying causes. يعني إحنا حكينا إنه chronic GI bleeding, for example, causes microcytosis and iron deficiency anemia. Okay. Do we have an overlapping condition that is making the patient not responding? We have to reassess the diagnosis. طيب, what if the reason of failure, يعني let's assume that the reason of failure turned out to be very poor adherence, patient is not adherent at all and unable to adhere مثلا, أو مثلا في عندي issues with the oral absorption, a disease condition, for example, that impairs the oral absorption of iron, GI condition أو gastrectomy, whatever. بهاي الحالة يعني failure of oral iron therapy أو the presence of a condition that impairs oral iron treatment, we go to parenteral iron. Okay, we go to parenteral iron. We have different salts formulations available for intravenous iron preparations or administration. We have 5 different formulations or iron salts. Okay. Parenteral iron salts هم ferric salts. Why? Because iron is transported in circulation in the form of ferric. Okay. الجولد ستاندرد أو the very first parenteral iron product هو iron dextran. It is still in use بس رح نحكي عنه له issues, عنده كتير issues. So we have other iron preparations in commercial use like the gluconates, sodium ferric gluconate, iron sucrose. Recently يعني we have 2 recent products اللي هم الفورmoxetol and the ferric carboxymaltose. This is the newest, very recently approved parenteral iron salt. They are different in the form of their kinetics, iron release, bioavailability. في overlap somehow بالadverse effect profile. A very important information to keep in mind that all preparations of parenteral iron, the 5 different iron preparations, they can all cause allergic reactions. Usually ممكن تكون يعني severe enough like anaphylactic reactions, okay? But the incidence or the extent is variable. يعني any one of these five إذا أخذوا المريض there is a risk for allergic anaphylactic reactions. However, the risk is always highest with iron dextran. And this is one cause why the use of iron dextran has declined. Why? لأن المريض إذا أخذ الأيرون دextran the patient risk of allergic reaction anaphylaxis هو أعلى higher than the other parenteral iron preparations, but it's still in use. We still use iron dextran. Iron dextran, let me talk about the calculations first, okay? هلا احنا حكينا لما بنعطي oral iron بنحسب انه we need like somewhere between 150 to 100 milligrams daily dose of elemental iron and to be divided into 2 or 3 doses. Okay, طيب, how should we of parenteral iron needed to give to the patient? We have this equation of
دكتورة الصوت بيقطع كثير سيء. الصوت مو واضح يعني آخر جمل كلها مقطعة سمعناها.
والله أنا مش عارفة، أنا ما بعرف. I really don't know ليش الصوت عم بيقطع. طب سامعيني هلا؟
دكتورة كثير عم
يعني
بيقطع.
Can you hear me?
دكتورة ممكن إذا كنت حاطة السماعات تكون العطل من السماعات.
No مش حاططهم. No. يعني أنا عندي full coverage الconnection.
دكتورة كثير الصوت بقطع.
دكتور المحاضرة الماضية برضو كانت نفس الإشي. دكتور حاولي تكوني قريبة من الراوتر.
ما عندي مشكلة بالconnection يعني it's full. ما عندي مشكلة بالconnection يعني the internet connection is good.
هو بيروح وبيجي. هلا الصوت منيح يعني، بس قبل شوي ما كان منيح أبدا.
اوكي طيب، يعني لما بيروح let me know. Can you hear me now?
دكتورة كثير بيروح يعني جملة بسمعها وجملة ثانية بقطع.
طب سامعيني هلا؟
هلا
سامعين.
طيب هلا we were talking about how much iron we need if we give parenteral iron. Okay? We calculate hemoglobin deficit. يعني احنا قلنا مثلا minimum hemoglobin level for a woman هو not less than 12 grams per deciliter. طب إذا إجت adolescent young female عندها لقينا gram per deciliter. How much is her deficit? قديش الديفيسيت عندها؟ It should be not less than 12.
لأنه راح الصوت.
إجت patient عندها الهيموغلوبين، عندها iron deficiency anemia. her hemoglobin was 6. الريفرنس رينج بيقول من 12 لمثلا 14. قديش الديفيسيت عندها؟ يعني بيقول الايديال هيموغلوبين رينج بده يكون عندها 12. قديش الديفيسيت هون بيكون عندها؟ 6 right 6 يعني بدها توصل ل 12 لحتى اعتبرها within the normal range right. فهذا الديفيسيت. اوكي ف we calculate the deficit multiplied by the body weight of the patient in pounds, not in kilograms, in pounds. هون بيطلع عندي the amount, the dose of iron in milligrams I have to add to that calculated dose. If the patient is a female, we add 600 milligrams to that dose. Is a patient male, we add 1,000 milligram to that dose, which are needed for restoration of the iron stores. فلما بدي احسب التوتال parenteral iron dose ما بوقف عند الدوز اللي بيطلع معي من الايكويجن، لا. keep in mind the ultimate goal انه replete او يعني restore the levels of iron in the stores. So you have to add to that either 600 milligram for a female subject or patient, 1,000 milligram to a male subject. By this, now I have the total amount of elemental iron needed that I should administer through parenteral iron formulation. Okay? Mute yourself, please. طيب.
ما
هلا
فهمت المعادلة اللي قبل، إيش ال600 وال1000؟ إيش نعمل فيهم؟
بتضيف فيهم إضافة على الدوز calculated بالمعادلة، يا بتضيفي 600 ملي جرام إذا كانت فيميل، يا بتضيفي 1 جرام 1000 ملي جرام إذا كان ميل subject. هيك بيطلع total amount of iron must be restored أو given to the patient.
تمام.
هلا لو سمحتوا بس لا تقاطعوني وأنا بحكي اللي عنده سؤال، أنا بعطيكم وقت آخر المحاضرة أسأله. Don't interrupt me. هلا الايرون ديكستران given parenterally, it was given through IM dose. Now we only give it through IV. Why we should not now consider IM iron dextran? Because of the adverse effects. يعني ال irritation to the skin, the staining, okay, pigmentation بيصير, tissue necrosis in the muscle if you give it IM. For now, we only give it, it's recommended to give as IV. Before we give iron dextran, because of the high reactions, okay, we should do what we call a test dose, okay? فبنعمل مثل test with a very small dose of iron dextran before we start to give it IV. Now, if the test dose result is negative, يعني ما صار عندي allergic reaction, this does not mean, هذا لا يعني إنه إذا أعطيت أنا dose IV ما رح يصير allergic reaction. Okay? بما معنى إنه even if the test dose was negative. طيب سامعيني هلا؟
الجملة اللي قبل دكتور هذا لا يعني وبعدين قطع ولا إشي.
هلا إذا test dose، إذا أنا أعطيت test dose of iron dextran، okay, and it turned out to be safe، ما صار عندي reaction، allergic reaction. Okay. This does not rule out. هذا لا يعني إنه خلال ال IV administration ما رح يصير allergic reaction. بما معنى إنه you have always
عم بعلق دكتور.
إنه المريض اللي عم ياخد iron dextran ممكن يصير مع allergic reaction أو anaphylaxis. What can I do? What can I do? The connection is really good. What can I do? فهذا بيصير allergic reaction أو anaphylaxis while we give iron dextran IV. Okay? هلا شو ال adverse effect of iron dextran؟ معظمها systematic constitutional، بيعمل weakness، myalgia، كمان بيعملوا هاي الأدوية commonly ممكن تعمل hypotension، drop in blood pressure، في overlap بالside effect profile between the different doses أو preparations parenterally. Okay, fever can happen، ومثل ما حكينا allergic reaction anaphylaxis with iron dextran can happen. Okay, the risk is high. هلا الفرق gluconate هو available يعني to be used available in aqueous solution. كمان بيعمل لي more or less flushing, hypertension, cramps, ache, muscle pain ممكن يعمل. iron sucrose same thing can cause cramps, hypertension. بيشبهوا بعضهم بالadverse effect. الفاريماكسيتول ما بيحتاج روتين يعني test dose، بس anaphylaxis can happen مثل ما حكينا يعني all the 5 different preparations can actually cause anaphylaxis. But we have to be always prepared إنه في setup جاهز للmanagement to rescue the patient during IV administration of iron salt because the risk of anaphylaxis is always there. Okay. The most recent iron parenteral iron هو الكاربوكسيمالتوز ferric carboxymaltose. This can be used as a replacement of patients who cannot use oral iron. الشيء السبيسيفيك بالسايد افكت بروفايل تبعه انه بيعمل hypophosphatemia. Okay, this is a little bit unique for this iron salt. في كتير iron salts ما رح ادخل بالتفاصيل بس في كتير iron salts parenteral approved to treat anemia in patients who need anemia management who have يعني end stage kidney or renal impairment. Okay. المرضى commonly they go into anemia, they need erythropoietin, iron salts, they need B12, they need folate supplementation. فعادة بياخدوا or parenteral iron. Okay. iron deficiency anemia for megaloblastic anemias, the gold standard management is oral iron. Alternative هو parenteral iron. You should be able to know how to calculate the doses. بتشابتر الأنيميا كل الدوزز مطلوبة. Okay, you have to know the doses and the calculations لتشابتر الأنيميا. طيب الميجالوبلاستيك anemia by definition is a kind of macrocytic anemia where the size or the volume of RBCs will increase, becomes larger, bigger than normal. Megaloblastosis happen mainly because of either B12 or folate deficiency. These are B vitamins. Okay. ال B12 هو يعني mostly we see or we find this is a water soluble vitamin. We must يعني mostly هو بالanimal resources. الفوليك acid هو mostly بالvegetable resources. Alcohol can induce macrocytosis. Why? Because it will lead to deficiency or excessive loss of B12 and folate. المرضى alcoholics they do have polyuria there is not only B12 folate يعني معظم ال B complex أو ال water soluble vitamins they are deficient. Okay. This is called alcohol-induced macrocytosis. Okay, if you stop the alcohol, if you supply B12 folate, it improves. But this is another cause of macrocytosis. Alcohol consumption can cause macrocytic anemia. The B12 deficiency particularly, it could be dietary. Okay, يعني ممكن يصير dietary deficiency مع إنه يعني if the patients have balanced healthy diet with good animal items يعني animal food يعني unlikely but it can happen. The risk is increased with age. However, a common reason for B12 deficiency is gastritis or removal of part of the stomach. المرضى اللي عندهم gastric cancer مثلا وبيعمل اللي بيستخدموا drug therapy that will reduce gastric acidity. Okay, خصوصا على long term. احنا يعني الايرون B12 deficiency anemia يعني بتطول لتبين لانه B12 is stored in the body. نفس الايديا تبعت الايرون. ف after the stores are consumed, okay, the B12 stores are consumed, then we start to see the anemia picture. Okay, بتبين عند المرضى. ال B12 as I said it's mainly stored in the liver. Okay, the body stores usually the deficiency to happen to appear, it takes very long term, years. Okay, so the patient has anemia, drop in hemoglobin, symptoms أحيانا B12 deficiency can cause neurological complications. This is serious. يعني المريض اللي بيجي عنده vitamin B12 deficiency anemia and in the same time we have neurological complications. For example, is complaining of memory impairment, cognitive impairment, numbness, paresthesis. يعني في عنده some neurological symptoms or complications. We have to give B12. This is urgent وعادة نعطيه بهاي الحالة parenterally not orally. Okay, رح نحكي عنه. هلا بما انها macrocytic anemia, we expect the mean cell volume to increase in size. Okay, hemoglobin drops. B12 in blood or serum levels will also go down. Okay, altogether suggestive of B12 deficiency anemia. When we treat with the same approach we talked about iron deficiency. So we have to correct CBC, hemoglobin, okay, blood, serum, B12 levels, and we have to replace the stores. Okay, يعني we want to replace the stores to decrease the risk of anemia happening again. If we have patients coming with neurologic manifestations, we need to manage more aggressively with parenteral B12 because if we don't treat adequately, this can cause irreversible neurological damage. ما بدنا نوصل لهاي المرحلة. Okay? عشان هيك المرضى اللي بيجوا وعندهم neurological symptoms, we give more aggressive treatment and we give it parenterally. Okay? ما بدنا ندخل ب irreversible damage. Okay? So how can we give B12? We can give it orally or parenterally. Okay? Oral therapy, oral supplements of B12 salts. عادة the starting doses, okay, for oral B12 تقريبا 1,000 or 2,000 micrograms. Okay? It was found and as effective as parenteral therapy. فعشان هيك most patients with B12 deficiency just give oral B12. Okay? هلا if as presentation المريض عنده neurological complications, we have to give احنا بنعطيه عادة injections. البارنترال B12 السايكلوكوبالامين هو السولت. اوكي، فاحنا بنعطي daily IM injections حوالي 1000 micrograms for the first week. Aggressively we treat. Okay, then we give the same dose but at reduced frequency. أقل فترة، يعني الفترة أو الفريكونسي بتصير أقل. ف instead of daily for a week, then we comes weekly for a month and monthly thereafter. Will duration of therapy is guided by of symptoms, B12 levels and blood, hemoglobin correction, and okay. Yeah, what should you know? No, parenteral is not actually better than oral, but parenteral is more aggressive therapy to treat patients, especially if they have neurologic symptoms. If the patients do not have neurologic symptoms, يعني جاي case B12 deficiency بس ما عنده any complaints neurological, you can just go ahead and give oral B12. Okay?
دكتورة
طيب
لو
في شيء
سمحتي،
اسمه
الصوت، تقطيع الصوت
Yes.
بخلينا نشت بالأفكار، يعني نحاول نمسك جملة ونكمل معك، بس تقطيع الصوت كثير مضيع الأفكار.
طيب what do you suggest؟
دكتورة تقدري تعملي ريكوردينج وتنزليه؟
Pardon؟
تقدري تعملي ريكورد وتنزليه على الاي-ليرنينج شعبتنا؟
الريكورد بنزل already والصوت فيه على فكرة واضح، يعني يمكن انتم مو سامعين الصوت بس الصوت على الريكوردينج رح يكون واضح. اوكي، ف I will give you the link to the lecture. لا أنا سمعت الريكوردينج المرة الماضية واضح. Let me see how it will go. خليني أشوف how it will go. خلينا نكمل المحاضرة we will see. بس يعني there is nothing actually I can do لأن الكونكت good. ما بعرف إيش المشكلة. بس
طب دكتورة، بس إنه ممكن
تعيدي
فكرة إنه neurological damage إنه تنعطى
neurological damage, you give parenteral B12. إذا ما في neurological complications, you start with oral B12. Okay? يعني الأورال is as effective as neurological، بس لأنه إحنا بنكون concerned إنه إذا في neurological complications it becomes more irreversible thing، فبدنا more يعني fast action، فبنعطيه parenteral. Okay? Otherwise ممكن we can just simply start the oral B12. Okay?
تمام.
طيب هلا side effect of vitamin B12 هي uncommon but it can cause hyperuricemia and hypokalemia. Okay. هذا بيعرف why it can happen. إذا أنا أعطيت B12 يعرف read it how treat hypokalemia. طيب what is مرق عليه كل ترم قبلك pernicious anemia؟ حدا بيعرف شو يعني pernicious anemia؟ سورة؟
لا أنا
رافعة إيدك أو
أنا رافعة إيدي من
yes.
عشان أسأل على إشي بسلايدات 20 كانوا، بس حكيتي لي إنه لآخر المحاضرة.
حدا بيعرف شو what is pernicious anemia؟ مين عم يحكي؟
أنا
raise your hand. Lana, next time raise your hand, okay? Yes. Do you know what is pernicious anemia?
Yes, اللي هي الأنيميا because of vitamin B12 deficiency، فبصير عنا decrease بال blood cells, red blood cells.
Eventually it will cause B12 deficiency، بس شو pathophysiology? What's the cause? يعني أي مريض عنده B12 deficiency anemia, is it by definition pernicious anemia?
caused by autoimmune process.
اللي بده يحكي يرفع ايده لو سمحتوا عشان اعرف مع مين عم بحكي. مين عم يحكي؟ مو مبين عندي، طالع عندي. اوكي هلا فردوس رفعتي ايدك. يس.
نعم دكتورة. دكتورة بيكون
يس.
deficiency بالintrinsic factor الموجود بال اللي هو يعني مسؤول عن الفيتامين B12.
Yes, excellent. هلا الفيتامين B12 absorption ما بيكون يعني free، بيكون in the form of complex with a factor secreted from stomach بنقول له intrinsic factor. المرضى اللي عندهم pernicious anemia هدول بيكون عندهم deficiency, some issues with the release and secretion of the intrinsic factor. So the oral bioavailability absorption of B12 is impaired وبيصير عندهم macrocytic vitamin B12 deficiency. طيب, how can we treat patients with pernicious anemia? شو المانجمنت؟ وعد؟
We can give parenteral vitamin B12.
Yes, we can give parenteral. طيب, can we give oral?
No, because
المريض رح يضل ياخذ parenteral B12 to the rest of her أو his life، يعني هذا عنده مشكلة permanent بالabsorption مثلا. طيب, can we give oral B12 to patients with pernicious anemia? How long they have to take it مثلا? طيب, read it in the book. موجود pernicious anemia, how it should be managed, and if oral B12 can actually be used to treat patients who have pernicious anemia particularly. لا الفولate أو الفوليك acid, okay, هو يعني water soluble vitamin very abundant in the green leafy vegetables يعني is not stored in the body. Okay, فبالتالي the human tissue يعني بيكون dependent على dietary intake of the vitamin. هلا في عندنا certain conditions that can cause deficiency مثل حكينا قبل شوي alcohol intake. في عندنا certain physiologic conditions where the requirements increase of folic acid, like in pregnancy, for example. This is normal that the intake or the dietary requirements will increase. Okay. هلا loss of the vitamin or inadequate intake يعني eventually will cause a folate deficiency. Simply we have to restore and we have to give the vitamin. We have to provide, treat. هلا ال causes of losing folic acid or folic acid deficiency could be because of alcohol intake, could be because of certain drug therapy. يعني في أدوية بتزيد ال metabolism, clearance of the drug, certain anti-seizure drugs, very potent CYP415 users like phenytoin, like phenobarb. Some chemotherapeutic drugs like methotrexate, okay, they are by definition folate antagonists. Okay, الميثوترexate, الpamitrexate رح نحكي عنهم. We assume that they will interfere with folic acid activation and so they can cause eventually folate deficiency. فبهاي الحالة, okay, we need to restore, okay. The folate deficiency can sometimes overlap with B12 deficiency because both will cause macrocytosis, okay? So we have to be very careful because if we treat B12 deficiency as a folate deficiency, now we can mask the complications that can happen and we will not be able to prevent the neurologic damage that can eventually happen because of B12 deficiency. But we have to be very careful. يعني الأسسمنت هون كتير مهم. If I have macrocytic or megaloblastic anemia, we have to make sure, is this B12, is this folate, and treat accordingly. Okay? هلا ال daily recommendations, احنا هنا بنحكي عن requirements of the folate. As you can see, بتزيد بال pregnant and lactating women, and this is a physiologic and regular, يعني شيء طبيعي إنه يزيد. Okay. والdeficiency عادة يعني becomes يعني ال patient إذا بصير عنده deficient folic acid intake, الأنيميا أو deficiency can appear within 3 to 4 months. يعني ما بتاخد فترة طويلة لأنه حكينا this is not actually يعني ما عندنا big stores in the body. Okay, ما عندنا huge stores that need long term to deplete, like the case of or iron, for example, or B12. فبتبين ال deficiency faster مع ال folic acid. Now, simply we treat with RS supplementation mainly, okay, of folic acid. 1 milligram daily is usually the dose. The duration عادة 4 months. هلا you can go up to 5 milligrams. Okay, يعني 1 to 5 milligrams on daily basis whole course of treatment for folic acid deficiency anemia. Now, if we have an underlying cause, yani if we know it is a drug-drug interaction, if we know it is alcohol-induced, for example, we have to manage accordingly. يعني إذا في مجال يتغير الدراج ثيرابي أو إذا في مجال إنه the patient should stop alcohol and so on, okay? We have to do it. Otherwise, we need to keep the supply. يعني لأنه المريض رح يرجع يدخل after a short term كمان 3-4 شهور ممكن يرجع معه deficiency again. Okay. الفوليك acid حتى لو انعطى ب higher doses unlikely يعمل toxicity it's excreted in the urine يعني ما بنخاف كثير من التوكسيسيتي not like iron or B12 مثلا ممكن يصير عندنا toxicity. all in all الفوليك acid is tolerated يعني ما يعني unlikely يصير toxicity منه. ومينلي احنا we rely on the oral therapy في parenteral folic acid بس يعني not routinely used to correct folic acid anemia deficiency anemia. Okay, on average 1 to 5 milligrams on daily basis for 4 months هو course of therapy. طيب, so we covered iron salt, parenteral iron, B12, folic acid. الدوزز حفظ مثل ما حكيت احفظوها. Okay. هلا في one kind of anemia we call it anemia of inflammation. Okay. Anemia of inflammation by definition is an anemia. Okay, drop in hemoglobin level. The etiology, the cause of anemia of inflammation is divided into two causes. Okay. Either the anemia of inflammation is because of acute critical illness. يعني مثلا مريض صار معه motor vehicle accident. Okay. دخل على الانتنسيف كير يونت. البيزلاين كان الهيموغلوبين ليفل عنده 12 جرام per deciliter. After second or third day it drops very fast. نزل ل 7 أو 8 مثلا. This scenario can happen. Okay. هاي بنقولها anemia of critical illness. Now the cause is complex. بيدخل فيه inflammatory mediators, بيدخل فيه cytokines. Okay. يعني it's complicated. But this scenario can happen. وهاي بنقولها anemia of critical illness, which is one kind of the anemia of inflammation. عادة quick يعني بتصير بالpatients اللي هم admitted to critical care أو emergency. The other kind of anemia of inflammation هذا the cause is inflammation, but this is not acute condition. This is usually a chronic condition. عشان هيك احنا بنقولها anemia of chronic disease أو illness, ACD. Okay. This kind of anemia usually happens as a comorbidity للمرضى اللي عندهم some chronic conditions. يعني مثلا معظم المرضى اللي عندهم autoimmune disease, اللي عنده systemic lupus, اللي عنده rheumatoid arthritis, with years they become anemic. Okay. المرضى مثلا اللي عندهم cancer, حتى إذا مش blood cancer. Okay, with the chronic illness ممكن يصيروا anemic. Okay, فالanemia of chronic disease هي not something acute. It happens as a chronic condition. عادة السبب بيكون inflammation. وممكن يعني يصير عندي drop بالهيموغلوبين ما بيكون very sharp. It can go down to 9, maybe 8. Okay, ممكن أشوف إنه ممكن ينزل ل9. في ناس 10 by definition anemic cases. Okay. هلا how should we treat anemia of inflammation? Okay. المانجمنت هون معتمدة على الهيموغلوبين level. Okay. معتمدة على الهيموغلوبين level. If the hemoglobin level dropped below severe, كان الهيموغلوبين level below 7 or 8. وإحنا بصراحة بالclinical settings بنعتبر 8 يعني the value 8. Okay. بنعتبرها هي الcut value. يعني مريض عنده acute illness دخل على intensive care. We are doing CBC on daily basis. لقينا أنه باليوم الثالث أو الرابع there is a sharp drop in him. نزل وصل 10. كان 13 14 وصل 10. Do we need to treat? No, we do not. طيب لو نزل وصل تحت 8 يعني صار 6 7 here we have to treat. Okay. فبالتالي what guide you to correct anemia of inflammation is the hemoglobin level. Below 8 grams per deciliter, we have to correct. How? What should we do? In this case, we have to give packed RBCs, not RBC transfusions. Okay. بيقولوا لها أكياس دم بالمستشفيات. هي actually مش دم. It's not blood. It's a packed RBC. It's an RBC. Okay. ال RBC transfusion أو packed RBC بتيجي بbags كل باج أو إحنا بنقولها بالمستشفى units. Okay, each bag, each unit expected to increase hemoglobin by 1 gram per deciliter. فإذا كان المريض عنده الهيموغلوبين below 8، افترض كان 7 أو 6، الهدف إني أرفعه فوق 8. الهدف مش إني أعطيه backed RBCs and go back to 12 or 13. No. فبهاي الحالة إذا كان مثلا الدروب 7، أنا بعطيه 1 unit of backed RBCs برفعه ل 8. إذا كان الدروب 2 ممكن أعطيه excuse me 6 بعطيه 2 units of backed RBCs and so on. يعني الهدف إنه يكون 8 فما فوق. أوكي. هلا في دراسات they tried erythropoietin and recombinant epitin alpha, DARP epitin alpha اللي هم عبارة عن يعني they just act like erythropoietin to induce synthesis of RBCs. Now, is this treatment FDA approved? يعني هل هاي الأدوية هي approved by FDA to correct anemia of inflammation? Actually, it is not FDA approved. فبالتالي it is best to manage according to guidelines. فبنعطي backed RBCs. Now, if this anemia is coincided مع هاي الأنيميا في عنا deficiency of folate, deficiency of B12, deficiency of iron, you correct accordingly. But it's not routine. مو أي مريض عنده anemia of chronic disease أو anemia of critical illness لازم نعطيه iron، لا، أو نعطيه B12. بنعطي هاي supplements أو بنعطي الأيرون أو البي 12 أو الفوليت إذا كان actually في deficiency. لأنه إذا ما في deficiency in iron وأعطيته iron بعمل له iron overload وبعمل له tissue toxicity. Okay, same thing with B12 for example. فhow we correct, we give backed RBCs. هلا في كتير مرضى اللي عندهم الأنيميا of chronic illness, okay, أو الأنيميا of chronic disease, their body adapts the new hemoglobin level. يعني بتكون مثلا على السي بي سي الهيموغلوبين 11 10 9.5. By definition this is anemia, okay, but they can readjust, okay. لكن المرضى اللي بيكونوا symptomatic أو الهيموغلوبين level very low, okay, below 8, في عندهم comorbidities أو complications ثانية, here we have to correct, okay. فالابروفد مانجمنت انه احنا نعطي باكت ار بي سيز لهدول المرضى، ومثل ما قلت لكم الكت اوف بوينت خلينا نعتبرها 8 grams per deciliter of hemoglobin. Below that give packed RBCs. اوكي، طبعا هاي بتنعطى بالمستشفى واندر supervision. الانيميا بالالدرلي we usually follow the same protocols. اوكي، الاختلاف الأساسي هو بالstarting dose of elemental iron. أنا حكيت إنه we do not start the regular average اللي هو من 150 to 200 milligrams. عادة we start at a lower range, يعني we can start 120 milligrams, okay, and we titrate up as tolerated, okay. فممكن أنا أحسب له dose إنه starting at 120 if tolerated بطلع شوي. Okay, if tolerated ممكن أطلع شوي and so on. لكن بنبلشهم من lower elemental doses of iron. Otherwise, the management in the elderly ما بتفرق. يعني we can use the same salts, we can use the same approach, but we have to be careful and do more monitoring, especially إذا كان المريض عنده comorbidities or polypharmacy. Okay, which is likely, very likely the scenario. Okay. هلا ال pediatric anemia. يعني most we can see B12, folate, iron, we can see any of them, بس معظمها بتكون most cases of pediatric anemia بتكون iron deficiency. Okay. ال pediatric anemia إذا كانت iron deficient, go to the okay. We have to give iron. Okay, so we have to give iron. The ultimate goal, same thing. We have to correct CBC and restore iron stores. Same idea. How much iron we should give? Okay, it depends. فهلا لما بيكون عندي أنا ال pediatric by definition he's أو she is an infant less than 1 year of age, okay, we have to dose iron based on kilograms of body weight, okay. The starting range لهدول patients infants 1 year of age or less, okay, هدول 3 to 6 milligrams per kg per day of elemental iron per day, okay. If I tell you إنه we have a boy, okay, a baby عمره 8 months, okay, 8 شهور عنده iron deficiency anemia وبدي أعطيه ferrous sulfate مثلا، شو وزنه 10 كيلو جرام خلينا نفترض مثلا، قديش هذا الدوز تبعه الديلي دوز تبعه؟ إذا بدي أحسب له على الإكويجن على البادي ويت قد ايه بده ياخذ الرينج تبعه قد ايه بده يكون؟ من 3 ل 6 ملغ بير كي جي. قد ايه بده ياخذ هذا البيشنت؟ سورة؟
سورة.
يس، قد ايه بده ياخذ؟ وزنه 10 كيلوغرام 10 كيلوغرام.
من 3/10 ل 6/10 ملغ باليوم.
الدوز كم؟ وزنه 10 كيلوغرام، عمره 8 شهور أو عمره مثلا 10 شهور، قد ايه الدوز؟
حكيت لك دكتورة، هو احنا بنحسبها من 3 ل 6 ملغ، يعني بتكون من 3/10 ل 6/10 ملغ.
3/10؟ احنا بنحكي 3 ملغ بير كي جي، هو 10 كيلو جرام. إذا بده كم كيلو جرام؟ بده كم ملغ؟
30 ل 60 ملغ.
exactly. إذا بده 30 ل 60 ملغ per day، صح؟ احنا قلنا 3 ل 6 ملغ per kg per day، وهذا elemental iron، هذا elemental iron right؟ فإذا بدي أبلش من 30 ملغ elemental iron in 2 divided doses for example, or up to 60 mg daily of elemental iron into divided dose once twice حسب الفورميليشنز الموجودة. اوكي، فهون احنا ما عندنا رينج، احنا عندنا رينج للدوز لهدول يعني 1 year of age مثلا الانفنتس. اوكي، طيب parenteral iron نعطيهم parenteral iron موجود but not recommended rarely used لأنه يعتبر toxic in this age group. Okay. As I said, we give it and we continue. يعني ممكن ياخدوا الدوز تبعهم يعني up to 3 months and we monitor accordingly. Okay. هذا المليغرامز هاي هي elemental iron per day and to be divided. Okay. ال B12 والfolate أو المacrocytic anemia. Okay. It can happen, unlikely. الfolate deficiency in pediatric population 1 ملغ daily، يعني بنحاول ما نطلع لل5 ملغ، نضل شوي بالlower range. اوكي، 1 ملغ daily and reassess. اوكي، ال B12 deficiency لما بتكون ب young age أو بالpediatric population we have to check whether it is pernicious anemia or not. اوكي، هلا pernicious anemia احنا حكينا البيشنت اللي عنده pernicious anemia ال B12 supply او ال B12 replacement is chronic يعني long term. وانا سألتكم اذا لازم ياخذها oral او parenteral. It is in the book. Does oral B12 work for patients with pernicious anemia or not? لكن بغض النظر بما انه هذا مريض pernicious anemia the intake, the replacement is chronic. بده يضل ياخذها for life. Same thing here. Okay. هلا الدوز الفريكونسي how many micrograms. Okay. titrated حسب المريض. Okay. لكن دائما بنحاول انه احنا we start at a lower dosing range, lower therapeutic dosing, titrate up as يعني as indicated. Okay. ال B12 can happen كdeficiency الفوليت ممكن يصير ما في فرق كبير من الادلت but recommended to start a little bit at a lower يعني supplement أو a lower replacement dose and follow accordingly. والهدف كمان بال B12 to restore ال B12 stores بال pediatric population as long as it is not pernicious anemia. Okay? فممكن يعني patients might take it for months as well. الأنيميا chapter هو مو صعب بس في دوزز كتير لازم تحفظوها. أوكي؟ ما رح أطلب منكم الانترودكشن بالأنيميا. I will upload to you شو المادة المطلوبة من chapter الأنيميا. أوكي بس الدوزات حفظ. وتيبل elemental iron كمان احفظوه. والإكويجن تبعت حسابات البارنترال iron كمان احفظوها. أوكي؟ ف يعني I am sorry for the يعني الصوت ما بعرف إيش المشكلة صراحة. I don't know. I'll try to contact IT. hopefully الأسبوع الجاي يكون الوضع أفضل. يعني أنا ما بعرف وين المشكلة. أوكي فخليني أشوف ال IT hopefully إنه إذا في issues أو guide أو tip إنه يتحسن الصوت. I hope so يوم الاثنين الجاي. الماتيريال الريدنج ماتيريال بالكتاب واضحة يعني الكتاب التكست واضح ما في مشكلة. read it. إذا في أي جزئية مش واضحة you can email me أو يعني بنرجع نعمل discussion بنهاية المحاضرة. إذا في على التحميل مقاطع مش واضحة ممكن أنا أرجع أعيد لكم إياها يعني hopefully الصوت يتحسن quality تكون أفضل الأسبوع الجاي. I can repeat any parts أو segments ما كانت واضحة لكم. طيب let me please ما حدا يطلع. let me download the attendance list. okay اوكي طيب طيب الاتندنس ليست داونلودد. اللي بحب يطلع احنا خلصنا تشابتر الانيميا. اوكي we will start ان شاء الله الروماتويد arthritis next time. بدي اسال التكست بوك موجود عندكم؟ في طلاب بعثوا لي انه مش موجود عندهم. you cannot buy it من البوك ستور مثلا بالمكتبه او برا مثلا. you don't have it. you don't have it even as a hard copy. ما عندكم hard copy منه؟
موجود
هارد
PDF
كوبي
دكتورة.
دكتورة.